Hi, everyone. Welcome to another Health Announcement Spotlight. I'm here today with Anjali Kataria, CEO and co-founder of Mytonomy, a fast-rising leader in enterprise cloud for healthcare. They're bringing innovative patient care into the living room. Anjali is a serial entrepreneur and former EIR and senior tech advisor in the Obama administration and at the FDA. Anjali, great to have you here with us today. I understand you attended Health in Boston, your first time at a conference since the pandemic. So we're really excited to have you back here today.
It's great to be here, Jody. Thanks for having me. And yes, I was at Health. It was great.
Amazing. Well, let's get into it then. So set the stage for us. Why'd you build Mytonomy's cloud for total joint replacement? And what's so innovative about this particular solution?
Sure. Well, let's take a step back. So putting total joint replacement into context, there are over 1 million patients that are having knee and hip replacements a year. And that number is growing fast, as is our aging population. And the sad part is that many people who are 55 to 80 are living with severe pain and they can't enjoy an active life. It can take 5 years on average today from first pain to the decision to have a joint replacement. And a lot of that is because patients don't understand what the surgery is, what their recovery process is going to look like. We have a big gap in helping patients understand and participate in shared decision making all the way through to patient recovery. And Mytonomy helps ease that challenge. It takes a load off of the nursing and surgical staff by providing the first broadcast quality streaming platform combined with a powerful new CRM solution that engages patients across the entire joint replacement journey. That's what's really innovative, combining the power of consumer streaming with their own physicians and the power of enterprise cloud and the capabilities that a CRM brings to drive engagement in a whole new set of ways.
So can you tell us a little bit more about how this works?
Sure. So through Mytonomy's cloud for total joint replacement, patients can watch over 200 plus short TV episodes, 1 to 3 minutes in length, of clinicians talking them through each step of the process. They hear from patients just like them. They can tune in and listen and see a physical therapist showing them how to use the walker before they have surgery. Patients get really comfortable and they have all the info that they need from trusted sources, their own physicians and their own hospital, all in one easy to access place designed for their own health condition and level of risk as a patient. So it's very tailored and personalized. And that's how they learn to care for themselves. We have to train people who are at home how to care for themselves, how to prepare and recover in ways we couldn't have imagined 20, 30, 40 years ago. And then they can make the right decisions for themselves to prepare and recover faster and ultimately lead a healthier, happier, longer life.
Yeah, that's great. Very unique. So can you talk to us a bit about Mytonomy's film studio?
Sure. Yeah, we have a film studio in Bethesda, Maryland. Our studio team comes from broadcast TV, from news. They're Emmy award-winning filmmakers and writers who have written and produced TV shows for cable and other streaming platforms. We combine them with over 180 subject matter experts, clinicians who are deep in their field. And that's where we get this beautiful 4K HD TV content that's exciting to watch and engaging. We also use microlearning and principles of cognitive learning embedded in these short TV episodes to help patients learn and retain the information better than ever before. And we give them a lot of freedom to watch on their phone, their laptop, or TV, really any device, anywhere that they are in the world. We've combined the viewing with surveys, communication capabilities, so that they can participate via their phone while they're watching TV content on their TV, or engage with that content and the surveys on a laptop or a PC, because this is a web-enabled platform.
And are you seeing patients binge watch this content?
Yes, we are. We're seeing a lot of binge watching. A lot of patients watch a lot of content at one time, just like you would see with Netflix or with Amazon Prime or Apple TV Plus. And they also watch a single video if we are delivered through an existing healthcare CRM, like a Salesforce or a HealthGrades or a Microsoft Dynamics. In those situations, patients get a link or a video or a playlist that is relevant to the campaign that the healthcare CRM is driving. I call this a drip model. Both models work, the binge or the drip model of engagement. In A/B testing that we did with Verily on some of their baseline patients, we found that we can optimize engagement in in-home care through assignment of a single video or content asset. And in Mytonomy, that single assignment actually drives much higher additional viewing and engagement. So both models can work together.
And how has Mytonomy's cloud for total joint replacement helped orthopedic surgeons in particular?
In two ways. One, we deliver better outcomes and a better patient experience. And the more we can optimize the health and education of patients with total joint replacement, the more we can improve surgical outcomes, increase patient satisfaction, decrease length of stay, keep patients recovering really well at home instead of coming back into the hospital, sometimes unnecessarily. We can, number two, what we're doing to help orthopedic surgeons and clinicians is we shift care onto the patient when they're ready to take that on. When patients are taking on more care of themselves, this decreases the burden placed on healthcare workers. It improves their quality and their safety and their experience. Clinicians leverage Mytonomy's evidence-based content and slip into a few of the videos themselves by refilming some of the clinically evidence-based scripts. And then we redeliver that to thousands of patients. So this is a scalable model that really can reduce that load and the burden on staff that we're seeing today and help prevent burnout.
And speaking of that scalable model, how has the adoption rate been?
Our overall adoption rate as an enterprise solution has been great. This is a new addition to that enterprise solution, so we'll see what this adoption looks like. But we were named number 835 in the country on the Inc. 5000 list of fastest growing companies in the United States across all industries because hospitals, payers, pharma companies all over the country like St. Luke's, Mass General Brigham, Cruling Clinic, Columbia, Duke Clinical Research Institute, Rush, Onduo, Verily, Exact Sciences, Affinity Health Plan, they've been adopting rapidly. There hasn't really been a tremendous amount of innovation in this space of patient education, engagement, and experience. So Mytonomy is right there, and we are seeing a lot of interest.
Great. So what does early 2022 look like for you?
We're starting off with a bang. We'll be at CES 2022, January 4th through the 8th in Las Vegas. We are going to have three big things going on at CES. First, we're revealing Mytonomy's full platform, our cloud for healthcare, which services 70 plus conditions. We're announcing today the cloud for total joint, but there's a much bigger cloud offering that total joint is a part of. And our cloud for healthcare is comprised of 5 different enterprise software modules, including our content cloud, which is a sophisticated content management solution for healthcare that just won a gold award by Digital Health, putting it best in class for content management solutions in our industry. We'll be unveiling our modern patient experience cloud, which is delivering a great consumer patient streaming experience. You'll be able to walk right into our living room in our booth, and you'll be able to see how our communication cloud, which is really cool, it nudges patients. It's a patient nudging system. And you'll be able to see what a smart survey looks like, which gets into the AI part of Mytonomy's solution, deeply personalizing the experience remotely based on insights and real-time data, and then playing that back by providing more and more personalized experiences. So we have a big product announcement there and a hands-on set of demos at our booth. Second, at our booth is our living room. And we'll be unveiling Mytonomy in Roku, our first TV app. We have several right behind it. And you'll be able to see this beautiful 4K HD, these 2,000 episodes across the Mytonomy cloud for healthcare, plus the 200 plus episodes we're announcing today, the largest collection for total joint. You'll be able to see that live and what that can look like in your patient's living rooms, in your hospital inpatient rooms. And third, we are conducting our third annual VIP delegation of CEOs and C-suite leaders who are tasked with digital transformation across their systems. They'll join us at CES, and we've arranged various briefings and a show floor tour and some discussions. So we're looking forward to that. And the rest of the year is very much jam-packed like January 2022.
Before we let you go today, just would love to hear about your first experience at Health. How was it for you?
Sure, it was great. I have to say, Health exceeded my expectations. The content and organization that you guys did at Health was really superb. It was just the right size during the pandemic. And I love the way that you tested everyone upon arrival. It really made me feel safe. And everywhere I turned, there were people I've been wanting to connect with, and the connections were so easy to make. That was a great conference.
Well, we very much appreciate that. And thank you for joining us today. We look forward to seeing you again next year.
Great. Thanks. Bye.